My name is Dr. Steve Mann. I'm a GP here in Stourbridge. I've worked here for 25 years and we look after 27,000 patients here at Lyme Health. We became interested in forming an MCP because we have a model of care here in Dudley which involves wrapping care around patients wherever possible in the community and where possible moving hospital-based services into a community setting. We can see that the demands being placed on primary care are rising inexorably. We have an ageing population with more illness, yet paradoxically more we can do for them. Patients often complain about fragmentation of their care. A key thing with the MCP is actually to integrate care within a single organisation. I think the way we've worked with the GPs in Dudley over the last several years, even dating back as far as fund holding, is we've worked together, and in fact half of the borough was covered by a fund holding collaborative. That has built trust over the years, which I think means that the GPs in Dudley trust their leadership to deliver the right things for them and for the people of Dudley. GPs are very supportive of the MCP and have formed a GP collaborative. The collaborative has a memorandum of understanding which sets out very clear roles and responsibilities for our practices, and currently all our practices are signed up to that. That has been a really positive move forward for us to allow us to negotiate about the MCP in the future. Contracts are a big issue for GPs because historically the GP contract has been seen as a contract for life. There are two main options we've been considering. Basically there's either full integration, where your practice is fully integrated with the MCP and fundamentally you become an employee of the MCP, or there's a partial integration model which means that you maintain your GMS contract. Here in Dudley we've been quite surprised because we had the idea that mainly GPs want to look at partial integration as a model of care. Actually there's been significant interest in a full integration model because people believe in the MCP process. And we've always made it very clear from a GP collaborative point of view that we would seek to have all practices involved in the MCP. If however a practice decides not to become involved in the MCP, the CCG will still commission services for them.
Do you think that other GPs are going to get to a point where they see the importance?
We feel the contract brings stability and enables us to plan on a long-term basis, which is really helpful. Model of care. And we certainly see the MCP as a big opportunity to bring in external partners, plus develop innovation at pace and scale here in Dudley. Obviously it is an outcomes-based contract and we have our own long-term conditions framework. This has been developed by our local clinicians and this will help us deliver better outcomes for our patients. With any innovative project, there's always a risk of failure. We believe that with our outcomes framework, our MDT style of working, that we have as good a chance as anybody of making a success of this. Having said that, if things go wrong, from a general practice perspective, there is always a right to return to your GMS contract should you need to. We're passionate about the MCP because we can see that current workloads in primary care are unsustainable. We know that resourcing in the NHS is tight, and we believe the contract will allow us to make a real difference to the care of people in Dudley.